Today, 5% of the LGBTQ+ community in Colorado is uninsured. Now compare that to 2011, when 10% were uninsured. That's according to a survey from the advocacy group One Colorado. Now this might seem like a big improvement, but those who are closest to the heart of this issue say there is still more work to be done.
So in today's Voices of Change, Jordan Chavez shares the resources available to those in need of better coverage and legal protection.
Colorado has, under the Colorado Anti-Discrimination Act,
the LGBTQ+ community faces unique barriers to health care.
Although the law in Colorado protects this community from discriminatory health care, that doesn't mean it's easy.
Even with legal protections.
To begin with, the insurance companies require that the care provided is what we call medically necessary. There's a real lack of training and understanding and certification on this issue.
The problems are exacerbated for transgender individuals, a community looking for specific care to help them live authentically.
This isn't deciding whether you're going to get a certain job or where you can live in this house. This is the embodiment of their person.
The road to treatment is twisted.
Unless you can afford to pay out of pocket, you're going to need insurance. And this community faces a disproportionate amount of employment discrimination. So if you can't get a job because of your protected status, it's much harder to be able to afford paying for government health care.
Paula Greisen has been on the front line of the court battles written into LGBTQ+ history.
You probably know Masterpiece Cake Shop. So I just finished the second trial involving the trans woman who was refused a cake.
And knows the struggles that come with interpretation of written law.
I was involved in a case recently where an individual needed medically necessary care. The insurance company denied it, and they denied it saying it wasn't medically necessary. We got some opinion from a dermatologist on the East Coast. So in that scenario, you have to appeal it and say, look, I want somebody who knows what they're doing to review this and decide whether or not this is medically necessary under the standard.
An organization known as WPATH, the World Professional Association for Transgender Health, has written medical standard guidelines used worldwide.
People that practice in this area will be familiar with those standards and will know how to follow them.
Guidance for everything from gender affirmation surgery to mental health treatment for LGBTQ+ individuals.
For people who can qualify under the WPATH standards, it shouldn't matter whether it's a private insurer or under Medicaid. The treatment needs to be provided under the law.
And the option for inadequate care or denial of health care service, a legal battle.
That process can be really hard for folks. And I think oftentimes that's what insurance companies are counting on, is that when they give someone a denial, that they won't appeal it. And so then they're saved from having to spend that money.
Marvin Allen is the Health and Equity Training Director for One Colorado.
And unfortunately, they're right, because a lot of folks don't appeal it.
They say it's important that these appeals are made, even if the result isn't the desired outcome.
In the long term, they are helping for future progress around gender-affirming care.
The process can get expensive, so there are options.
In some cases, it's possible to file this pro se, meaning without a lawyer, and filing a complaint in court. Certainly, the Colorado Division of Insurance, people like Care Achievers, can help navigate.
If somebody has an issue or they've run up into a barrier to getting the care that they need, they should contact us. They can file a complaint or ask for help by either emailing me directly or through our portal online.
The Colorado Division of Insurance regulates insurance policy within the state.
So the Colorado Anti-Discrimination Act explicitly includes sexual orientation and gender identity. The Division of Insurance passed a rule a few years ago to explicitly prohibit discrimination in insurance coverage for people based on sexual orientation and gender identity.
However, the DOI only regulates 1/3 of health insurance in the state, specifically the individual market, where people get insurance outside of their employer within the state of Colorado. So how do you know if your insurance is under DOI jurisdiction?
So look at your insurance card and look for the CODOI designation.
Regardless of jurisdiction, there are steps you can take to make sure you're protected first. Do your research before picking an insurance plan.
It is such a hard thing, especially when folks are shopping on the marketplace and they have multiple carriers and multiple plans to pick from. One Colorado develops insurance buyer's guides.
Don't be afraid to individually contact insurance companies.
It's really important for them to reach out to their insurance company directly, typically in writing, to find out prior if a surgery is or procedure is covered.
Keep that documentation handy. And above all, know you are not alone.
There's still a fight ahead, but it can be won. But it is going to take persistence. And it's going to take community.
The effort you put in now will change the course of LGBTQ history.
Trans folks are beautiful. Oh my gosh, we are revolutionary. We are opening up doors for people of all genders to be who they want to be.
With producer Victoria Valenzuela, I'm Jordan Chavez, 9 News.
Within the last week, Governor Polis announced that gender-affirming care would be added as an essential health benefit effective January 1st of 2023. The Division of Insurance says before the governor's change, gender-affirming care from individual and small group markets was covered because insurance carriers needed to comply with our state's non-discrimination protection. However, coverage varied and was less transparent.
If you need help navigating your insurance policy, we have links to resources, insurance guides from One Colorado, and links to the State Division of Insurance. You can find that on 9news.com.
9 News continuing to work to feature minority voices telling stories of change in our communities. If you want to see more stories like this, you can go to 9news.com/voicesofchange.